I'm Michael Olagbero. I'm a histopathologist in training, and I consult for the Big Breast Cancer Foundation. I also run the Doctor on Air platform, which helps us bring actionable health information to the general public in layman's terms. Basically, that what is happening now should not happen. It's abnormal. The breast is not something that is hidden. It stares us right in the face. So any disease of that organ should not be something that causes so much profound suffering and even death. And that brings us to, if that is so, then what should we do? First things first, we need to be a bit more aware of what cancers are generally, and of course of what breast cancer is. Breast cancer being the highest killer of our women, talking about cancers currently in Nigeria. Secondly is, after being aware, we need to know, how do we prevent? Prevention on different levels. Prevention from, how do I reduce my risk of having breast cancer, which means as a woman, I must know what are the risk factors for breast cancer, what are the ones that I cannot do anything about, but the ones that I can change, let me do something about them. Secondly, we must be able to detect breast cancer on time. Since the breast is so accessible, there are very simple means of finding out that, okay, is there something wrong with my breast, and could this thing be a cancer? So simple things such as breast self-examination, going for a mammogram, which is a form of an x-ray of the breast, and also going for a clinical breast evaluation, which will involve at least 3 different specialties of doctors. The surgeon clinician, who uses his hands and eyes to examine and to see what is on the breast, but cannot see inside it. Then you have those who are called radiologists or imaging physicians, who use other forms of technology to see, as it were, into the breast. And then you have the histopathology, which is my own specialty, where you take some little part of anything that you see, or at times all of it, and examine it like I'm doing here under a microscope, and then describe, what type of cells am I seeing? What does this look like? That's important because it tells us, 1, is there or is there not a cancer? 2, if there is a cancer of the breast, what type of breast cancer is it? Breast cancer isn't like malaria, that's a single disease. It's a cluster of different diseases, of different cell types that behave differently, and that have different propensity to cause death, and also have different responses to treatment. So you need us to do that. And then when that is done, you can either catch breast cancer at its very early stage, at which point if you simply remove that growth and you throw in some radiation on it, you knock it off. And 10 years afterwards, 95% of these women will still be alive with no further problems. Or even if there is a locally invasive breast cancer, you are able to take it out, take out the margins, note how far it has spread, and then advise the oncologist, how do I treat this person? So those are the major areas that we need to do. Now, with regards to awareness, every woman should be familiar with her breasts. This is not about sexuality now, it's about health. Every woman should be able to know when there's something different about the way my breast looks and about the way my breast feels. Every woman must know that breast cancer does not mean a death sentence. The major reason why our women die from breast cancer is not because there is a cancer, it's because a cancer is caught late. If you were to live in a housing estate and there is a burglar or even an armed robber that is going to come to your house within the housing estate, if you catch that armed robber in the next town before he enters your town. You arrest him, hand him over to the police, you are safe. If you catch that armed robber when he gets to the street on which your estate is, there's some more local commotion, but still, it doesn't get to your house. You are safe. If you catch that armed robber at the gate of the estate, there's some more inconvenience, but still, you are safe. But if you wait for that armed robber to be inside the gate and the door of your house before you catch him, then even the process of catching the armed robber itself may cause more harm than good. So care of breast cancer is something similar. A stitch in time saves 9,999, not just 9. Now, having known that, then what do we need to do? Number one is, what are the risk factors for breast cancer? Being a woman is the major risk factor. Yes, we have breast cancer in men and also in women, but in men it accounts for about 2 to 3.5% of cases. In some communities, even less than that. So if you're a woman, you're at risk for breast cancer. Secondly is the fact that all cancers increase in frequency or in occurrence as we age. So you are a woman, you are approaching or you've passed menopause, then that's a risk factor. Now, those two risk factors, you can't do anything about them. You can't stop yourself from being a woman, and you can't reverse the hands of time. However, there are other risk factors that one can do something about. If you have any family member, male or female, who has had a breast cancer, particularly family members who share your genetic pool, someone that has maybe your mother, your sister, your uncle, someone that you have a direct link to. Not if your husband, for example, has a breast cancer, doesn't mean your wife will have a breast cancer, except somewhere down the line they are genetically related, so those risks won't count. That, once you know, it means you can go ahead to closely monitor yourself for possibility of breast cancer. There was something that happened a year or two back. I think it was Angelina Jolie, an actress, who realized that she carried the genes for breast and possibly ovarian cancer. And she went ahead and removed both breasts and had her breast reconstructed surgically so that you wouldn't know there's still a breast, and in fact, they are works of art to look at. But she has removed herself from the risk of breast cancer because she's aware of the family history. Secondly is the age at which you have your first live birth. A woman gets pregnant, she has a delivery. The age at which that first delivery happens is also important. Why? With modern society, my grandmother got married possibly before she was the age of 20. My mother 23 or thereabouts. The average 23-year-old now is either in university or at best doing youth service, and still has to get a job and work. So most women don't get married till they are 30. It's been found out that there's a strong increase in risk of breast cancer if you have your first child after the age of 30. So the earlier women say I do and get into settled childbearing families, the better. Now, if you also attain menopause later in life, most women at about the age of 45 to 55 will go through that period where their menses gradually slows down and it stops, and for more than a year, there's no menstrual flow. That's referred to as menopause. If you, as a woman, get to extend that period, which you may not be able to control now, way beyond 55, 60, then your chances of breast cancer are increased. However, you can control the fact of being overweight. Women who are overweight are known to be at increased risk of breast cancer. Women who are tall are also at a risk of breast cancer. Now, why that happens, we honestly do not know. But one other factor that is coming to light recently is exposure to vitamin D. That's something your body really processes from the sun. So persons who stay most of the sunlight hours away from the sun, particularly in environments where they don't have as much sunlight as we do have in Nigeria, are at some measure, it's not a high level of evidence, but we know there are associations with that of increased risk for breast cancer. The one that our women in Nigeria can control. These days, lots of our young women in particular are taking up the habits of going to nightclubs, spending long hours of the night exposed to different types of lights elsewhere. So women who stay awake late into the night have increased risk of breast cancer. And you can modify that. Go to bed early. It's as simple as that. Women that take alcohol are at increased risk of breast cancer, even cancers of the esophagus, of the throat, of the stomach, and risk of other things too. Women that smoke. Tobacco smoke exposure is responsible or contributes directly to a myriad of human cancers, and women who are exposed to tobacco smoke, including shisha smoke, which is in vogue with our ladies now. So ladies will say, I don't smoke cigarettes, but I take lots of shisha. It's similar compounds that you are being exposed to. Now, even if as a woman you do not smoke, do not hang around boyfriends, friends, or even enemies that smoke, because you're also exposing yourself to a similar, if not higher risk. The person that smokes has a filter in the cigarette towards where he inhales or she inhales that filters some of the tars and combustion products of tobacco away from you. But the person at the other end of the cigarette stick inhales everything. So secondhand tobacco smoke also is a major risk factor. So women that stay late at night, women that do night shifts, and women who use oral contraceptive pills for periods of more than 10 years are also at increased risk. This is simply because they expose themselves more to the hormones that are responsible for growth and development of breast cells. Now, having said that, one can now say, okay, these are the things that put me at risk, and these are the things that reduce my risk. Now, we said those things that increase the risk. Now, what reduces the risk? Obviously, avoiding those things that we've just mentioned that you could handle. Secondly, is what kind of lifestyle do you choose to adopt? Lifestyle in two major areas. What do you eat? If you go around lots of eateries, from the cafeteria to even some so-called restaurants, the diets are high in carbohydrates and fat, and rather low in vegetables and fruits. Diets that are high in vegetables and fruits are known to offer some significant measure of protection against cancers, apart from even the breast cancer of the colon and such. So, as women, we should change our idea of what is food and embrace the idea of what is nutrition, and then take more of it as nutrients rather than just consuming different substances. So lots of fruits, lots of vegetables, taken every day, not once in a while. In fact, if possible, take fruits at every single meal. Now, exercise. Women that maintain active physical activity, exercises, particularly in their young ages, by young I mean less than 30, and around and after menopause, have reduced risks of breast cancers and of cancers generally. Now, aside from that benefit of exercise, it also helps to reduce the intense weight gain that may make you obese, or the weight gain after attaining menopause that makes you more at risk of breast cancer. So exercise, appropriate diet, avoidance of alcohol, reduce or avoid nightlife, and avoiding tobacco smoke exposure will be things that will help. Now, aside from risk factors, what else should we know? I said earlier, every woman should be familiar with her breasts. That means she must be able to examine her breasts herself. A number of times, breast cancer will show up as a discrete, distinct, do I call it a swelling or a growth? And that can be picked up. Self-breast examination can be done by any woman and should be done by every woman. It's very simple. It requires no equipment apart from your eyes, your hands, and a mirror. It does not require you going to the hospital, and it can save your life. When should a woman do breast self-examination? Every woman should be aware of her menstrual cycle. You should know what day it starts, what day the menstrual flow ends, and what is the interval between the beginning of one menstrual flow to the next. Having known that, the 4th and 5th days after the flow of the menses has stopped are the best dates to do a self-breast examination. So if a woman's menstrual flow starts, for example, on the 1st day of the month, it flows a little scanty on day 1, that's the first. 2nd, 3rd, and 4th, it comes a bit more. On the 5th, it trickles off. On the 6th of the month, there's no more flow. So 6th, 7th, 8th, 9th. The 9th, for example, and the 10th day of that month will be the ideal days for the woman to do a self-breast examination. How should she go about doing it? Quite simple. On the morning of that day, get out of bed, have your bath, and stand in front of a mirror. Stand with your arms behind your back. You know, there's this trick that women play when you want a man around you to notice you, the way the woman subtly thrusts out her chest, making her breast more visible. Now, that movement is something similar. It tenses the muscles that lie on the chest wall and under the breast and makes the breast more prominent. That way you can more easily see if there's anything. So look at yourself facing the mirror, and on either side, look at yourself with your side to the mirror. If you notice any unusual thing about it, if you notice that maybe the skin of the breast appears to be swollen with things that look like small, several dimples within it, it's been described as looking like, have you seen one of those big oranges that look a bit rough on the surface?
Yes.
It's been called like an orange skin appearance. So anything like that is there, then go see your doctor to confirm. If you notice that there's any area of dimpling where the skin, you expect a smooth contour of the skin of the breast. If anywhere appears pulled in, then go see a doctor. That may be a sign of anything, and it may be sinister, so go see a doctor. If you notice anything that disrupts the regular contour, now look at the back of my hand and look at my knuckles. You expect the skin of the breast to be smooth. If you have anything that juts out and disrupts that contour, that could tell you there's a growth in there. So go see a doctor. If you see anything at all that is unusual about your breast, go see a doctor. Having done that, then you feel, rest the breast on one of your palms and gently, beginning from, divide your breast into 4 quadrants, a line running up and down through the nipple, excuse me, and left and right through the nipple. That gives you 4 segments. So use the tip of your fingers to gently feel each of those 4 segments. Then feel around your nipple and squeeze the nipple to observe if anything comes out. And when you've done that, pass your hand over the side of your breast towards your armpit and feel again. Because you already have some residual breast tissue towards there. So if anything unusual at all, go see your doctor. Now, if a woman does this severally and as a matter of routine, when anything is unusual, she would know. And then she will know, okay, let me go look for help. As simple as these things are, it will help us catch breast cancer quite early. I know of a doctor who caught hers quite early, and she was just about 24, 25 when she was diagnosed, and she's survivable today because she caught it early and it was knocked off. and she's undergoing follow-up, and so far, so good. Now, for women who are approaching the age of 40, above, or approaching menopause, being able to feel might not be that easy because the tissue of the breast now contain less fat and more fiber. So for this category of women, it's advised you go for a mammogram. It's just like an x-ray of the breast, so that what your eyes cannot see from the outside and what your fingers cannot feel from the outside, mammogram will show you that it is present. And then of course your doctor, your imaging physician will now advise you on what next to do.
Alright.
Very simple and life-saving.
Okay, thank you very much, sir. Now the next question is, why is breast cancer common in women than in men?
Than in men, okay. In the course of development, when a woman gets into puberty, you will notice that is when you begin to notice the woman develops a breast. Before then, she and the female child and the male child, the chests look similar. Now, as the woman grows from a girl into a woman, you have the body prepares to come to a point where it can secrete milk so as to nourish life. So there are several cells that grow that are able to secrete milk in the woman. That does not happen in the man. You just have a few cells like that just around the area of the nipple. That's why in some males that are going puberty, there's a short period when there may be some small secretions from the breast. But after a week or a couple of months, it fades off. It doesn't come again. Just at that period. But for a woman, those breast ducts continue to grow. Now, breast cancer comes from the cells that line those milk-producing ducts. So that's why you have breast cancer in women. Something that is also important that I think we should mention is that yes, the breast occurs somewhere in our chest, but in the course of the baby's development, there are other areas of the body where some breast tissue may form, usually around anywhere from around a line from around top of your collarbone, make an arc through the nipple, and an arc that goes that way towards the groin. So there are times, though not common, where there may be residual breast tissue in those places. And some of those may also develop cancers that will be breast cancers. So you could theoretically have a breast cancer of the anterior abdominal wall, for example, arising from some of those nests and rests of breast tissue. Oh, thanks. Well, quite a lot. The major thing we've done on Doctor on Air and Michael Abakin Foundation has been to address audiences. And the audience reached so far is way in excess of 10,000 persons, live audiences. That discounts the radio shows and the rest of them. And we have a forum called Doctor on Air that meets every Saturday. And that happens from 10 a.m. till about 8 p.m. with some follow-up on Sundays. It's a virtual platform on WhatsApp and on Facebook, and we pass across messages. But very importantly, this year we began to collaborate with the Big Breast Cancer Foundation, which has some very bold aspirations concerning breast cancer. And part of the plans of that foundation for this year, in fact, in the next 1 or 2 weeks, is reaching out to more than 1,000 persons with essential information that can act upon concerning breast cancer. There are other activities that that foundation has planned out also, that range from increased awareness to advocacy for improved care to helping to soften the impact of treatment of breast cancer on persons with breast cancer. But pardon my quoting the Bible, the harvest is plenty, but the laborers are few. We need more laborers for this harvest. Volunteers. The major problem with any health condition is that we don't have enough number of people who know enough about it to talk enough about it and to act enough about it. For example, in Nigeria now, we have possibly one or at most two of machines for treating breast cancer patients functional. We have Zaria, National Hospital, Abuja, Ibadan, I think Benin, and some other places. But do they work? The answer is no. Maybe one at any given point in time works, which means a woman may have to leave Port Harcourt to go to Abuja or Zaria or Ibadan for treatment. I mean, that does not make sense. But do we have enough women who feel provoked that something of this sort can happen? You know, we'll carry placards and protest when the price of oil, of petrol goes up. But nobody protests that we don't have enough doctors. The last exams that took place for training specialists in my field, I'm not sure there were up to 20 people. What am I saying? Possibly not up to 5 that became specialists. Only about 120 people qualified to begin specialty training. So we don't have enough doctors to diagnose and to treat breast cancer in Nigeria. And our women are comfortable. A woman will spend 100,000 naira taking care of her hair at a single sitting and spend. I had a friend who spent 5,000 naira fixing her nails. Now that 45 and 150 is already 200 or thereabouts. I've not mentioned the lipstick, I've not mentioned the massage, I've not mentioned the facials during the month. Now, do you realize that you can actually fund an advocacy and awareness campaign with less than 500,000 naira and reach out to possibly 10,000 Nigerians and possibly prevent the next 100 cases of breast cancer from happening? So we need more women to feel provoked enough to do something. The money you spend on that vacation to Dubai can be spent on breast cancer and kept for next year. I know of women who have abandoned treatment because cannot afford the care. We've now come to a point where drugs for breast cancer no longer come from the European countries where you used to get them from. But people are now forced to go to Malaysia, Indonesia, India for medication. We've come to a point where people have to travel out of the country for treatment, and it is a shame that we have close to 90 million women in Nigeria, and about 30 million of them within the working group who earn an income, and yet no woman is provoked enough to do something. It's a shame, really.
Thank you very much, sir.
Thank you.